following presentation is brought to you by Merck Incorporated. Merck, be well. Here at Merck, we aspire to be the best healthcare company in the world and are dedicated to providing leading innovations and solutions for tomorrow. From developing new therapies that treat and prevent disease to helping people in need, we're committed to improving health and well-being around the world. Employees at Merck work day and night to ensure our mission is accomplished. Our researchers are equipped with the latest technologies that allow them to bring new medical treatments to light. We believe in operating openly, honestly, and with the highest degree of ethics and integrity. Our goal is to lead the way to a healthier future, but we also care about how we can get there together.
The truth is, when I go into work every day, it's not about making the next dollar. It's about making a difference.
That's why I love working for Merck. Not only do I surround myself with intelligent people, but we get to work towards making the world a healthier place. On behalf of Merck, we are proud to announce the success of our latest medicine, Balsamra.
Meet neurologist Charles Grant. We brought him in to discuss how effective Balsamra is in treating chronic insomnia.
Insomnia is a condition in which an individual has difficulty falling asleep or staying asleep. Contrary to common belief, insomnia is actually not a disease. Instead, it's a symptom caused by other sleep disorders. But there can be caused by diet or stress, anxiety. Insomnia affects nearly almost half the population. Chronic insomnia affects roughly a quarter, and those affected are more likely to suffer from depression and develop a serious illness in the future.
Balsamra essentially blocks the brain receptors responsible for keeping you awake. I took part in clinical trials, and there's nothing to say that this drug works extremely well. The clinical trials were extensive and thorough. To study the clinical effects of Balsamra, 2-3-month efficacy trials were done over a 12-month period. We wanted to know how well does this drug help those suffering from insomnia sleep, and the results were amazing. Next day, driving studies were also performed to determine how this drug affects you in the morning.
Balsamra, known as Suvorexant in the lab, works as an antagonist on Orexin receptors in the brain. Orexin is a natural brain chemical that is responsible for keeping you awake. Unregulated Orexin levels is what keeps insomniacs awake at night, and Balsamra works against that. Balsamra denies Orexin from binding to its respective receptors on the brain. In essence, Balsamra helps those progress into the sleeping state. In many case studies, Balsamra proved to be very effective and did not result in chemical dependence. After taking Balsamra orally, sleep onset occurred after 60 minutes. Onset was most rapid in those that received higher doses. Suvorexant has a volume distribution of 105.9 liters and is highly protein bound. Balsamra is primarily metabolized by the cytochrome enzyme system. Balsamra is eliminated primarily via inactive metabolites in the feces. There is no renal elimination. Introducing Dr. Frank Cannoli, the medicinal chemist responsible for coming up with the structure of Balsamra. He based the structure by studying the natural binding of orexin. He was generous enough to explain his synthetic approach.
Hey, Frankie Cannoli here. So, after the discovery of Orexin A and Orexin B, the agonist in '99, we wanted to start working for a drug that could, act as an antagonist to both Orexin 1 and Orexin 2 receptors, So, Balsamra, or what we call it Suvorexant in the lab, represses signals of wakefulness, promotes sleep by inhibiting these Orexin receptors. And so when coming up with the structure of, Suvorexant, I wanted the drug to have a high binding affinity, obviously, so it could work through the night and not disrupt the waking part of the 8-hour sleep cycle. So people often ask me too, Frankie, how'd you do it? And I said to him, I said, you're going to make this big thing. You got to start with diazepam core here. You got a 7-membered nitrogen ring. Right? That's pretty hard to make. So you got to start with that, or else you're going to mess it up later in synthesis. All right, so you start with diazepam core, but it was tough because, you wanted to improve this procedure for large scales, but then, you run into problems with diazepam core. But, the first way we did it was you start with vinilic acetone and BOC protected ethylene diamine, right? And you treat this reaction mix with CBZ, which protects the other amine seen here. So then in 2 steps, the first of which removes your BOC, and the other is treatment with sodium triacetoxyborohydride. Gives a racemic mixture of the diazepam core, right? It's racemic. You got your R and your L configuration, but you need the R configuration. The L configuration ain't gonna work later in the synthesis, right? So you reapply the BOC protecting group, which prepares the protected racemic diazepam core for chiral HPLC, which takes your R enantiomer and your L enantiomer and separates them, right? So then you got your isolated R enantiomer, and you can remove the BOC again, which gives the desired CBZ protected R enantiomer of the diazepam core. So then you couple the core with this carboxylic acid containing compound right here, 5, which generates a substituted diazepam core seen here. So then you pull off the CBZ of the other amine with a palladium catalyst and hydrogen gas, and the unprotected substituted diazepam core is formed. So then, in your final step, you treat it with this chlorine containing compound seen here, and bada boom, you got an MK4305. Better known as Suvorexant. Better known as Balsam. You know what? This is all well and good, but we wanted to, we want to be able to get people to have this drug, so we got to make it on large scales. So we're using 5 protecting group steps in this thing. You can't do that if you want it on large scales. You're losing so much yield in the isolation processes, and you're wasting so much you could get back. And, plus it's called the azamical reaction to prepare 2. It's low yielding because you form something else called a methylvinyl ketone adduct, and you also form a bunch of different byproducts, which is why you need the HPLC, the chromatographic purification, if we're going to sound fancy about it. So the prep HPLC separation, it's going to be difficult and costly on large scales. So we got to identify a new route in which these, we can get around these concerns. Hey, Frankie Cannoli here again. Alright, so how are we going to get around this? Alright, so what you first can do is you take your chloro-substituted carbon, the chloro-carbon, listen to me, the chloro-substituted compound that you see here, and you take it, and you just simply do your azamical addition, right? Like I explained last time, and then with that, you can have your asymmetric reductive amination. And simply using Uri's SS RuCl catalyst, right? And you'll form your diazepam core with the R chirality because of the nature of the asymmetric reductive amination, right? So you have your R configuration with diazepam core and the left substitute part. And so what else you gotta do? Boom, one more. Just get an amide coupling reaction in there and you got Suvorexant, right? With the right chirality. Look at that. That might be better on kilogram scales, since you don't have to use the classical resolution. And then from that, yeah, you got Suvorexant on kilogram scales. Very promising. People often ask me, Frankie, why not cure cancer? Why not, go do something, actually good? Why treat insomnia? I say to them, it says to them, not only is, insomnia detrimental to the overall well-being of those who suffer from it, but an interesting study from this guy named Kessler, he went out and he found that insomnia can actually cost employers money. So he took a sample of about 7,500 guys, and he found that insomnia was significantly associated with lost work performance due to presenteeism, which is just a fancy word to say he's on the job, but he ain't doing a good job. You know what I mean? So you lose about 11 and a half work days of work performance per insomniac. 1/5 of the guys identified as insomniac. So in that estimate of this, you use put a monetary number on it, you're losing about $2,500 a year per insomniac, right? You believe that? And apply these parameters to the entire United States, you're losing about $65 billion a year in the industry for insomniacs. So I says, well, I could try to cure cancer my whole life and not actually do it, or I can make insomnia medications, save the workforce some money. that's what I did.
With extensive research and consultation out of the way, Balsamra was accepted for review by the FDA in 2012. After careful and serious deliberation, Balsamra was approved by the FDA on August 13, 2014, a little over 2 years after development. And now, a message from our marketing team. Are you constantly tossing and turning at night? Do you suffer from anxiety or depression? Do you have trouble falling asleep or staying asleep? Talk to your doctor, as you may be suffering from chronic insomnia. Those with chronic insomnia, characterized by excessive lack of sleep, often have trouble focusing, being productive, experiencing joy, doing anything important, not being a zombie, have a strong affinity for caffeinated beverages, and experience narcoleptic-like symptoms. Introducing Balsamra. Balsamra is a novel nighttime sleep aid developed by Merck's top scientists. Balsamra works by binding to and repressing receptors in the brain responsible for keeping you awake. Balsamra was designed to help those who suffer from chronic insomnia get to sleep and stay asleep. This leaves you feeling refreshed and ready for a productive day. Ask your doctor about Balsamra today, and you're taking the first step to getting the best night's sleep. Common side effects include headache, sleepiness, dizziness, abnormal dreams, dry mouth, cough, and upper respiratory tract infection. Do not take Balsamra with alcohol. Do not take Balsamra if you are pregnant or at risk at becoming pregnant. See your doctor about Balsamra today. Balsamra is the sole property of Merck Incorporated.